Compliments of the day to you all. I'm Mary Nyamayaro and I'm going to present on the effect of low glycemic diet on diabetes mellitus. I chose this review title because the prevalence of morbidity and mortality of diabetes mellitus is relatively high and seems to increase rapidly. And it is estimated that by 2030 it would have doubled. With reference to the figure, looking at Asia and Australia, in 2000, the prevalence was 82.7 million, but in 2030 it is estimated to have doubled to 190.5 million. Taking into account other continents also, it applies. And based on the World Health Organization data, it is estimated that 1.5 million people died in 2012 from diabetes mellitus. Diabetes is known as the eighth cause of death and mainly common in developed countries, and Australia being one of them, but the main cause in low to medium income countries. In 2010, 285 cases of diabetes were reported, with 90% being type 2 diabetes mellitus, and type 2 diabetes mellitus is caused by unhealthy eating habits like high glycemic diets. Nevertheless, low glycemic index diet have shown to reduce the chances of occurrence and control symptoms, and also aid in treatment of diabetes mellitus, both type 1 and type 2. Data searching strategy. Information was retrieved from the library electronic database, and Cochrane is the database that was used to extract these systematic review articles, and the searching words used were glycemic index, diabetes mellitus, and randomized controlled trials. After this was done, articles were selected, and the quality assessment of evidence was critically analyzed by appraising these three articles, and followed by analyzing the checklist questions in order to determine the relevance and validity of evidence. The level and quality of available evidence. The level of evidence is level 1, which is systematic review articles, and gold standard method was used to assess articles selected. This level of evidence is regarded as the highest quality of evidence, as it provides a reliable base of evidence and large clinical impact reviews, and it has adequate details on the trials, details such as outcomes, participants, and it has consistency in all studies, making all the studies homogeneous. Moreover, it is high generalizability, meaning that the population of study is same as target population, and it has high levels of applicability, meaning that studies can be applied to the Australian healthcare. There were various sources of bias in these review articles. Some of them involved studies lacked power to detect significant effect, meaning that studies lacked power to detect the significant effect of low glycemic diet on diabetes, and some studies did not give full details on the studies, and some studies had low sensitivity to affect the impact of low glycemic diet due to lack of follow-up and dropouts of participants during the experiments and trials. There was also binding of clinical operator, random allocation of generalization and concealment, and in some cases compliance data was missing beyond the end of the study, and incomplete outcome data was missing, both primary and secondary. And some studies were broad research questions, therefore interventions were difficult to compare. The outcomes from the studies and the reviewed systematic review articles shows that low glycemic index diet have beneficial effect on diabetes mellitus, as it seems to control symptoms and it can prevent symptoms, thereby reducing complications, and it can act as a dietary treatment as it tends to control the glucose levels in diabetic patients, preventing excess rise of glucose levels, which can pose severity of symptoms and complications in diabetic patients. There are many lessons that were learned from this literature review. Low glycemic diet can be used as a preventive measure, dietary treatment, and to control diabetes mellitus symptoms. And also, I've learned how to carry out research process by designing and identify ethical issues and evidence-based practice. And also to identify and take note of bias and confounding variables. And also, I've learned about diabetes mellitus frequency and association. To conclude, there is strong evidence that support that low glycemic index diet have beneficial effect on diabetes mellitus, as it functions to prevent symptoms, control symptoms, and as a treatment for diabetes mellitus. And here are the references. Thank you.